Hi, this is Dr. Chris from St. Paul Chiropractic and Natural Medicine Center. Check us out at stpaulnaturalhealth.com. Today I want to talk about evaluating a low back. So this is a model of the spine. This would be a side view. This would be where your tailbone is, and how we develop or evaluate pelvic stability is what I want to go through today. Many times there can be changes in the alignment of your pelvis, maybe from having babies or sitting at a desk or just general stress of life, but there's very specific ways that we can test muscles around your pelvic area to determine how the nerves are working in your low back. Okay, so I'm going to have my lovely assistant Emily over here why don't you let's start laying face up for me. Because all of the nerves in your low back control all the muscles in your legs, and it comes from fairly specific areas, we can get dialed into exactly where this nerve root irritation is coming from. So what I'm going to start off with is I'm going to start testing what we call front or anterior pelvic stability, and we're going to do that by testing two muscles. One of them is going to be the IT band or the tensor fasciae lata. And so what I'm going to do is I'm going to raise the leg up, I'm going to turn it over, and I'm going to have the patient just hold steady right there. I'm going to push right here and resist and see if she can engage that muscle. I'm not really testing for muscle strength. I'm seeing if the muscle can engage and hold strength in that position. So far, looking pretty good. The other ones are going to be more of the internal muscles, like the adductors of the legs, that are going to be associated with something called your pubis symphysis, which is the bone right here at the base of your pelvic bone where they connect. It's called a shear joint, so sometimes that can kind of move up and down. In order to evaluate that joint, I'm going to have the patient, in this case Miss Emily, I'm going to have her hold her foot with a rotation to the inside, and I'm going to pull this foot, her leg towards me, and she just needs to resist. And again, not testing for true pelvic muscle strength, but engagement. Hold strong. Okay, front of the pelvis so far looking pretty good. Let's go face down. Now the pelvic and the sacrum and the low back is a really dynamic joint. There's a lot of different movement ability that's happening here. Right now, we're going to test the glutes, and then I'm going to test or your butt muscle, and then one of those muscles in your butt is also called a piriformis, and that's a hip rotating muscle. But we're going to start off with the glute on this side. I want you to hold right here for me. I'm going to push here, and she's trying to cheat because she's hold right here and hold. Good. Hold and hold. Okay, so we're finding a weakness there. Hold strong. And it just doesn't want to engage on that side. So the question is why? There's a lot of reasons why that muscle could be having a problem right now. My question is, if you can come right down over here, is there a misalignment in the pelvic bones? So I'm going to try to change the structure of the pelvis to see if we can engage that muscle right now. So I'm going to put a block. These are called SOT blocks or pelvic blocks, a part of a tool that we can use to not only evaluate, to improve nerve and muscle function because of a structural change. So now I'm going to have the patient, or Emily, raise this leg up again and hold strong. And Emily, tell me, how much stronger is that?
A lot.
A lot stronger. So actually, for this demonstration, I'm going to correct this problem right here, right now. And it's a very low impact. Doesn't have any popping or clicking or sounds associated with adjustment. It's one of the most effective ways I've learned how to take care of low back and pelvis dysfunctions in a really easy way. And so these tables have these drop pieces on them. And all I'm going to do is I'm going to come through and I'm going to contact hip and a pelvis, and we're going to use these drop pieces to see if we can affect a neurologic change right this second. So I want you to raise this whole leg off the table, hold right there, and hold. How much stronger is that?
A lot.
Good. So that's how fast the neurology changes. The question is, how long does it last? And we'll get into some of those other questions and later. But yes, we can make that stick. We can make positive changes through consistency and you doing your part at home. Next, I'm going to test the piriformis muscle, which is a hip rotator. I'm going to have the patient hold right here, and I'm going to lift up on her leg, which is engaging that piriformis. We'll try the other side as well. And hold. And again, really sluggish, doesn't want to engage, just a weak muscle that has an inappropriate neurologic firing pattern, so the nerve's not connecting to that muscle effectively. So now I'm going to do a challenge to see if there's a way that I can improve that. So as I'm testing the muscle, I'm going to hold down different parts of her sacrum or her low back, and I'm going to find a spot, right, get strong, there, and then again, where we get that nerve to engage that muscle again, I'm going to move the skeletal structure in order to take the pressure off the nerve. Now the noise is just a table dropping. This is not anything dramatic, or I'm not, this is not her body making these noises. This is the sound of the table. But after we've done that, we always want to retest and hold strong. And man, it's had a big change, okay? So very quickly, we've identified neurologic deficits because of structural changes. We do a fast but effective evaluation of that, and we can change things just like that. Have a great day.